Welcome to The Explainer. We're going to dive right into the heart's hidden electrical system and figure out what happens when that beat gets blocked. You know, your heart has this amazing, sophisticated electrical system. Seriously, think of it like a perfectly timed messaging network. It's this intricate dance of signals that makes sure every single part works in perfect harmony to keep that rhythm going. But what happens when that electrical signal gets blocked or slowed down? Well, that's a condition we call heart block, and today we're going to demystify it together. We'll look at exactly how this incredible communication system can, well, fail. All right, so here's what we've got on tap. We'll talk about when the beat slows, the different degrees of delay, from dropped beats to a complete block. Then we'll touch on the causes, and finally, we'll see if you can spot the rhythm. Let's jump in. All right, first up, when the beat slows. Let's figure out exactly where heart block fits in the big picture. Okay, so this chart kind of lays it all out for us. At the very top, you've got arrhythmias. That's just a fancy word for any irregular heart rhythm. Now, if you follow that path down the left side, you hit bradyarrhythmias. That just means the heart is beating too slow. Think less than 60 beats a minute. And boom, right there under that category, you see it, AV block. That's exactly what we're talking about today. So what does this actually feel like? Well, when these electrical blocks happen, you might get dizzy, feel really tired, or short of breath. Sometimes it can even cause fainting. But, and this is important, sometimes you might not feel a thing. Especially with the milder types, a person can be completely asymptomatic. Okay, let's move on to the different degrees of this thing, starting with the mildest form, first-degree heart block. This one is all about a minor but very consistent delay in the signal. I love this analogy. Think of the heart's electrical signal as a piece of mail. With a first-degree block, that piece of mail is always late. Every single day, it shows up late. But, and this is the key part, it always shows up. The delivery is delayed, but it's reliable in its delay. And here's what it looks like on an ECG. See that first little bump? That's the P wave. That's the signal starting up in the atria, the top chambers. Then you see that big spike, the QRS complex. That's the signal hitting the ventricles, the bottom chambers, and making them pump. Now look at the gap between them, the PR interval. In first-degree block, that gap is just longer than it should be. But notice, it's the exact same longer gap every single beat. Okay, so things get a little more interesting with second-degree block. We're moving beyond a simple delay. Here, the signal sometimes doesn't get through at all. We get dropped beats. So second-degree block actually comes in two main flavors, Mobitz Type I and Mobitz Type 2. With Type I, you can see it coming. The delay gets longer and longer until a beat is dropped. It's predictable. But with Type 2, nope. The delay is constant, and then just boom, a beat is dropped out of nowhere. And it's that surprise, that unpredictability, that can make Type 2 a lot more serious. So here's Mobitz Type I. You might also hear it called Wenckebach. You can literally trace the pattern on the screen. Watch that PR interval. It gets longer, a little longer, longer still, and then poof, a beat is dropped. You see that P wave just hanging out all by itself with no QRS after it. It's like the mail delivery getting later each day until one day it just doesn't show up. Okay, now contrast that with this, Mobitz Type 2. Look at the PR intervals here. They're all the same. They're identical. They're consistent. And then, bam, a beat is just gone. There's a P wave, clear as day, with nothing after it, no QRS spike. Because this is so unpredictable and it happens deeper in the heart's wiring, it's generally considered the more serious of the two. All right, now we're at the most severe form. This is third-degree heart block, or as it's often called, complete heart block. We're talking about a total, absolute communication breakdown. So to go back to our mail analogy, the delivery service is completely 100% down. The messages from the top chambers, the atria, are not getting to the bottom chambers, the ventricles. The sender and the receiver are totally on their own now, completely out of sync with each other. And this ECG, it shows that chaos just beautifully. I mean, look at it. The P waves, those are the atrial beats, they're just marching along at their own nice, regular pace. And at the same time, the QRS complexes, the ventricular beats, are marching along at their own much slower regular pace. But there is absolutely no relationship between the two. They are completely and totally dissociated. It's like two different drummers in the same band. Okay, so what in the world actually causes these communication breakdowns? Let's take a quick look at some of the underlying factors. Well, it can be a whole host of things. You could have damage to the heart's wiring from a heart attack, what we call ischemia, or maybe there are structural issues with the heart itself. Certain medications like beta blockers or calcium channel blockers can do it. Even things you might not expect, like electrolyte imbalances, infections like Lyme disease, or complications from cardiac surgery. The list of potential causes is actually pretty wide. All right, you've seen the theory, you've seen the examples. You ready for a little quiz? Let's put that new knowledge to the test. I'm going to show you a few rhythms, and you try to spot what's going on.
Okay, first one up. Take a good look at this strip. What do you see? Notice that long, but super consistent, PR interval before every single beat? Yep, you got it. That's the classic signature of a first-degree AV block.
All right, how about this one? Look closely. The P interval is nice and consistent for the beats that actually make it through. But then, all of a sudden, there's a P wave just sitting there with no QRS complex to follow. That's our unpredictable dropped beat. That makes this a second-degree AV block, type 2. Okay, now for this one. Follow the PR interval from left to right. See how it gets a little longer, and then a little longer, and then bam, a dropped beat. That's that classic going, gone pattern we talked about. That second-degree AV block, type 1, the Winkebuck. And finally, our last one, what's going on here? The P waves and the QRS complexes are totally doing their own thing. They are completely independent. See how the P waves are marching along at one speed, and the QRS complexes are just kind of plodding along at their own much slower speed? That total dissociation, that's the dead giveaway for a third-degree or complete heart block. So you see, if the heart's rhythm is its music, what really happens to the body when the conductor loses control? It's pretty amazing to think about. Understanding these patterns isn't just some academic exercise. It's about recognizing how a tiny electrical glitch can disrupt the entire symphony of the body, and it really makes you appreciate that incredible invisible conductor inside all of us.